Now we talk about what is a nutcracker esophagus. What is a nutcracker esophagus? Alright, so this is what a nutcracker esophagus look like. So you have some abnormal constrictions along your esophagus. Okay, so nutcracker esophagus is also called what? Hypercontractile esophagus. So it's a primary esophageal motility disorder. So there's excessive peristaltic forces. So the forces tending to contract along the esophagus, which should have been very uniform. Up contract, down relax. Do you understand? They are excess. So it will lead to what? A spastic motility disorder. Okay. So pathophysiology, normal peristalsis is coordinated, and the contraction is what usually moves food down. But in the nutcracker esophagus, the contractions are too much, but still coordinated. Funny enough, exact mechanism is unclear. It's thought to involve esophageal smooth muscles being hyperactive. Okay, so unlike achalasia, the lower esophageal sphincter relaxes. Okay, so you diagnose it using manometry, and you see that there's high altitude peristaltic contractions, but there's normal lower esophageal sphincter relaxations. Okay, you can also use endoscopy and also barium swallow, okay, where you image along. So clinical features is chest pains. Okay, you see the image and how it will look like. So chest pains, that's substernal chest pain. Dysphagia, there's difficulties in swallowing because there's some abnormal contractions. But if the food goes past those swallowing, if it comes to the lower esophageal sphincter junction, usually goes through. So heartburn or reflux-like symptoms. So complications: quality of life is impaired, rarely progresses to other motility disorders. Okay, there's no increased risk of cancer. Okay, so management: avoid caffeine, avoid taking alcohols. Medications, you can give calcium channel blockers to handle relaxation, nitrates to also relax the muscles, proton pump inhibitors to reduce the reflux. Then they can also do surgical options. They can also give botulinum injections to paralyze the muscles, thereby reducing the contractions and all of that.